Dr. Radha, you are muted, ma'am.
Thank you, dear. Good evening to one and all. First, big thank you to TIPS ECHO and Palliative India Trivandrum and the whole organization. It's a pleasure to have got the opportunity to present today. And in the next 40 to 40 minutes or so, we'll have, as she has mentioned, we'll get an idea of importance of communication in palliative care and its significance. In a minute, I will share the screen. Can you all see the screen now?
No, ma'am, we are not able to see the screen.
1 minute, give me a minute. Okay. Okay, good afternoon to one and all. Once again, as we're going to see information on what is the significance of communication in palliative care. Okay. Good communication is vital. Every word counts because we all know in our day-to-day living that how important communication is. To be successful in anything that you do, you have to be a good communicator. Okay? So it has a very vital role. Next, what is communication? By the word communication, what do we try to understand and what we need to understand? Communication is a process by which information is exchanged between individuals through a common system of symbols, signs, or behavior. So as mentioned in this itself, communication can be of and with many things as mentioned. We will see each one of them in detail in due course. Next, types of communication. Communication could be a verbal one, which we all do, and it varies from region to region, continent to continent, based on the language that we use. And next, something called as non-verbal communication. This also we are all aware. Not every time we need to talk to communicate. Our eyes speak, our face conveys. So everything has got, even though by keeping quiet, you could say that you like or don't like. So non-verbal communication has a very big role too. And in non-verbal communication, as I said, eyes, face, your body language has a big role too. So non-verbal communication also has a big component. Next comes a very important thing, visual communication. Just one picture can convey so many things. Here I'm going to take a very common example. A movie poster, one poster will tell you so many things. I think no one will disagree with me in that. So visual communication has a big role. And as all of us know, we are also aware of something called as photographic memory. What we see, we remember a lot. And we remember it for a long time too. So each component of communication has a big role to play. Next comes importance of good communication. Why is good communication is needed? Why are we having one session itself on this? Because there is significance. Good communication helps you to connect with people effectively, helps to know them and come close to them as sufficiently as needed. Here also it's important. You should do it in the right quantity also. And it helps you to make them comfortable. At the end of the day, what are we all aiming for? Comfort, peace, happiness, that's what it is. So the ultimate objective should also be achieved. And also, not last but not the least, it helps you to gain their confidence. If you're a good communicator, they will be confident to confide in you because it is going to be something very personal and special. So gaining confidence is very, very essential. Next, the importance or the significance of communication in palliative care. Here, the points which are mentioned are very, very important and salient. Complex symptoms and situations are going to be dealt with. And we also have to manage those complex situations and symptoms. Why? A little bit more I would expand in this. Because, see, palliative care as such is not something simple and straightforward, which each one of us might have known or have had some experience or some reason why it has brought all of us to this platform or place where you are interested or you have got some focus in doing something to the society. As it is not simple and straightforward, we have to spend some time and give importance to it. And by dedicating, you will be able to manage it. So because it's not simple, straightforward, if we put some more effort, it can be made simple and straightforward. So that is what we are going to try. So because of the nature of the situation, we are trying to understand it more and at the end of it, achieve success. So the complexity is there, but anything complex can be made simple also. So that is where we are going to use the skills. And next, it is communicating something which is difficult and different. As I said, it is not something like a routine thing happening. But at the same time, it has to be understood, explained, and then made or simplified. A difficult or different condition can be just by lack of awareness or something could be the issue. So the difficulty can be overcome also. So these are the two salient features which are there in palliative care. So which we will see in great detail about them in the next few minutes. Hope my speed or is all good, or do you want me to go slower still? Anything like that, please do let me know. I'm okay to carry on?
Yes, ma'am, you are. We didn't get any comments in chat yet.
So in that, thank you very much. Okay, now we are going to see the communication skills per se. So that, as I have said, we have to become good communicators. So by utilizing these skills, we can achieve our goal. As we saw in the outset about the importance of non-verbal communication, here we are going to see a little bit more. First, smile. There's a common statement which says, a smile takes you a mile. Yes, it definitely takes you a longer distance than if not having it. So the importance of that is that I'm going to give you a simple example. In today's world, everyone uses Google Map to go about or do everything. But if you imagine a situation, you're in a new place, you don't know how to get to some destination or something like that. You have tried some things, but still, maybe you would have tried your Google Map, but still you go there, it is not showing the correct thing or some, for example, I'm telling. At that point of time, you have got to approach someone. So you've got two people. One person is having a big smile, another person is not interested in talking to you itself. So whom would you approach? Automatically, we'll go to a person who has a smile so that we have confidence, we have faith that he would help us out. So smile is very, very important. Even if we don't have the habit, we can cultivate the habit so that it will help us to achieve or be good in ourselves and be good to others too. And here I would like to say, if you smile, you use less muscles. If you frown or cry, you use more muscles. If you want to stay young all the time, keep smiling. That is the best way forward. Okay? And smile is very, very important in palliative care. Why? Already, the other end, the receiver, is very upset and not happy with the situation he or she is in. And so, personally, they may not be very happy. But by seeing a person who smiles, its smile is very infective, So it will bring about a smile in the person who is very sad and even crying. So that is very, very essential. Next comes posture and position. This also has an important role, especially when you're seeing a patient or family. This being in level with the patient. If you see this picture, the nurse or the carer and the patient are in same level. If you're in same level, it gives confidence and comfort. If you are standing and the person is sitting or the patient is sitting, that gives a hierarchical role, which is not very good. So either way, being at a higher level or a lower level doesn't help in these situations. So same level. If the person is sitting, you also kneel down or get to pull a chair and sit or something like that, so that both are in the same level. Next is eye contact. Eye contact is very, very essential. If you're not going to have eye contact, the other person may think, oh, they're not interested in me. Just for the sake of coming, they have come. So eye contact is very, very essential. Next comes personal space. This as such has an element of cultural and gender-based significance in it. So here, ideally would be, everyone has a personal space. So ideally is not to intrude into another person's personal space, but at the same time, not to stay very, very aloof. So ideally, by approaching the person with a smile and giving good eye contact, you will get a feel what is the right personal space. And ideally, to give some distance and to start communication and things, and not to enter into anybody's personal space is also something which has to be followed. This in due course of time, as you work with families, patients and things, you would pick up the importance and significance and what exactly is the personal space allowed and not allowed to. Next skill is active listening. There's something why it is mentioned as active listening, because it is different to just namesake listening. Active listening means you pay attention to what is being said and how are you going to convey that. So that we are going to see by the eye contact, and you don't fidget or do anything during the conversation, and you stay focused and you listen to the person who is talking to you, and also not to interrupt them in between. You have asked them something, you give them the time to express and explain. So being patient is also important. That is why the importance of not to interrupt is mentioned here. And also you convey to them that you are listening by either a nod or saying something, yes, go ahead. Yes, what carry on, you carry on to tell what you would like to express. So you give cues, and also by your body language, you try to say that you are listening to them. And here also continuing to maintain the eye contact would be very useful. And next, once, okay, you have asked, you're listening, and if you're at a stage where you want to ask questions, what type of questions are you going to ask? It is preferred to ask open-ended questions. Why again? Because by asking open-ended questions, you would get a better detailed response and a true response. For example, I will tell you, was your day good? If you ask like that, they will say either yes or no. If you were to ask, how was your day? Then they may say, oh, today I got up this time. I did so many things. I had a nice day. Or no, I had a horrible day. I ended up going there. I didn't get the answer that I wanted. I came with some ideas. It was all not. So just the way you ask the question, you would get a better answer. So everything is important. So that is why open-ended questions are preferred rather than one. You don't ask questions where you will get a single word answers. Okay. Next thing is, sometimes remaining silent and neutral will also be very good, because as you're asking, if you give them some time, they themselves will try to come up with something which is deep down in their heart. Or they might not even thought of telling that, but by you giving them some time and staying silent, you may get some very, very confidential information also, which they would want to share. Because why do they want to share? They want to get some solution for it. So being silent and patient and neutral, this neutral is very important. Being not prejudiced. Once if you say something, no, this is not what, express your opinion, what they wanted to say also, they may not say, oh, this person won't like if I answer like this. So being not prejudiced is very important in situations like this, so that you get the true picture from the patient or the carer. Next comes clarity. Okay, when you are going to explain something, it has to be in clear language, because you, like the person who is going to receive the information from you may not know everything. So try to keep it as simple and clear as possible. Jargons, why we say some things like abbreviations, these type of things, no, not everyone knows. So try to keep it simple and straightforward. And also when you are telling, if you are telling some information, halfway through the information, you please pause and ask them, have you understood so far what I have said? If you want me to tell once again, I'm happy to do that. So that itself, they'll think, okay, have I understood? If not, I can ask them again. And also important is in the tone and volume with which you speak. That also carries some information about you and the information that you give. Next comes empathy. Empathy is the capacity to understand what another person is experiencing from within the other person's frame of reference. That is commonly we say the capacity to place oneself in others' shoes, in another person's shoes. That is to know or explain to them that I do understand your situation. I can understand why you are going through these problems. And if I were in your place, how I would have been, something like that. So it's just to show your situation that you understand, and it's not easy going through this, so that they will not think, oh no, she might undermine me or anything like that. Next comes a very important as volunteers and in palliative care per se, team working is very, very important, because palliative care itself is a multidisciplinary, multimodal management. It's a group teamwork or team effort, because multiple people together are going to work together to give the best outcome for the patient. So in team working, what are the essential components? First, we have to respect each one of us, or each one person in the team, and everyone equally. Because once you respect everyone equally, that's what each one would expect from the other person. So by doing so, the outcome is going to be successful only. And only when you work together, you're going to achieve the success. Because as I said, the mode of management itself is multimodal, and it is a multidisciplinary. And we will see through, I'm going to give you some examples and things, so which will help you from each aspect. And in all this, what are we going to do? We are going to keep the patient in the center of, and patient's best interest is only our goal. Individual person's best interest doesn't come there. So who is our goal there? Aim, goal, objective, everything is doing something best for the patient. So that is important. And also we have to look at everything in a broad picture, because we have to have the patient as a whole, not the issue alone. So you have to consider the social, cultural situations, everything. That is why I've mentioned here as broad picture, because for not a narrow-minded approach will not help there. That is why we have to have, even if we don't know, we can learn more about their cultural and social interests from the patient and the family and the carers, and then do what is in patient's best interest ultimately. Now coming to like, what are the specific situations that we have to deal in palliative care? As we saw in the beginning, it is a sensitive and emotional issues are there which have to be considered. Social and cultural elements will also be there, which have to be respected accordingly. And we do have financial and resource-related aspects to be looked into also, and they have to be managed appropriately. Finally, last but not the least, spiritual thoughts and values have to be revered too. Okay, now we have seen what are the things that are there. Now we are going to see how are we going to manage these as volunteers. What are there? How are we going to manage? And as I said, we can look at it under these various headings. Various aspects of palliative care are there. We have medical issues, we have patient care, we have social issues, we have psychological and emotional issues, we have financial shortfalls, and we do have cultural and spiritual issues too. We'll go into one by one to some extent. Okay, first we would look into medical issues. Communication, like communication in palliative care for doctors and medical professionals as such is a very big topic. It is very important because, as I have mentioned, everyone has a role. So that one, I am not going to go in very great depth because like the receiving audience, mainly if it is exclusively for doctors, it's done in a great detail. I would just give some salient features alone, and we would deal with the rest in more detail. Normally, the big issue is breaking bad news. And in that, you have where to tell, what to tell, how much to tell, to whom to tell. And so we have to find the right situation. We have to know how much the patient knows, how much they can accept, and how much they've understood. So, and then we have something called as a phase of denial. And so those are things which are taken into it separately. But from all of your point of view, what I thought was, even in that front, as volunteers, you could be of great assistance. How? See, the patient, for example, you can take some, not everyone may have a big family. Some people may have family, but they might not want to confide, but they might have come by themselves or something like that. So in those situations, if the patient feels comfortable, you can accompany them and go with them and be with them as a supportive person, which that itself may give them some confidence. So they may feel, oh, I'm not all alone in the world. I have got someone who can come with me. So you can be of some assistance to the person, even if they're on their own. So, and if sometimes they may be happy for you to be with them because see, some language barriers could be there, or they may not understand something. They may say, no, I'll be happy if someone comes with me. It will be of assurance to me. And also, if you could explain to me in more detail. So even in that point of view, even from a medical point of view, if the doctor is going to explain, you can accompany the patient or the carer or someone. They say, no, I would like to understand a little bit more. So you could do a supportive role there. Next, inpatient care. See, as volunteers, we can develop some skills and help patients in many, many aspects. So this patient care as such, here also, the role of a nurse can be there, and also a role of a carer. Carer can be someone who is, and the patient's needs also will be very variable. Some day-to-day activities or day-to-day chores may need some assistance. So there also it can be, the role of a volunteer could be helpful. The role of a volunteer for the patient, for the carer, for the families. So here I would like to say that you could develop the communication skills which we have mentioned. Just being a person who can sit and talk to the patient and make them comfortable. See, the non-verbal skills, if you develop and try to inculcate into your daily living, that can help. So developing the communication skills and using the acquired skills to render the service. And as I mentioned, you can teach the patient and carer some easy home care nursing solutions. There are very many things which can be used. And I am going to give you a couple of examples which will come very handy for the patient, for the carers, and for every one of us. And even making general public, raising awareness in the public and society will help every one of us in a long, long way. So here I have put two important things. Hand washing. See, hand washing, it has been globally proven by many, many studies that simple hand washing can save patients and save lives. So what the picture on the left-hand side just shows what are the steps or methods in hand washing and how you have to wash. Everything is important. See, rubbing in between the fingers, rubbing in your nails, thumb area, and then putting some, just soap and water wash. You don't need big hi-fi solution, nothing like that. See, what I'm telling is proven, like many, many studies have been done globally. And this is what is practiced everywhere. You like simple hand washing, and then it has to be done for a few seconds, not a namesake one. Just as I said, as the picture says, if you rub in between your fingers and do all this front, back, and wash it with soap and water, make sure that your soap is off your hands, and then wipe it with a towel or a sheet. Okay, this, and especially with the current COVID condition, all of us have become very hygienic, and it's good. Always let us take something good that we have obtained from COVID too. So simple hand washing is very, very important. And if you teach this to everyone, nothing, this itself, you would prevent infection, prevent diseases, and so many advantages could be obtained by simply teaching hand washing techniques. And next slide shows where, when you have to do it. So if you do this, it's commonly said in these 5 points, like before, if you do this hand washing technique, before you approach or you're going to do some care for a patient. Why do you wash your hands before? That is for the patient's benefit, so that you don't carry any infection and you don't pass it on to the patient. And then next, after you see the patient and do things, you have to hand wash again. That hand washing is for what and why? That is for the carer's benefit. See, whatever infection the patient may have, that is not transmitted back to the carer. See, when you are going to look after a patient, the carer also has to be looked after, because both have equal significance. And then next, if you're going to deal with any body fluid, okay, you're not doing anything with the patient, but you're going to deal with body fluid. For example, you're emptying the urine bottle or some other fluid, any fluid from the patient. So in that situation also, you have to wash your hands before and after. And if you're going to touch the patient or change sheets, anything like that. So these are the situations which is commonly said. And clearly, I would repeat once again, washing before touching patient or body fluid or anything, that is for the patient's best interest. Washing after is for the carer's best interest. So both are essential, both are important. So see, these two things which are very, very basic for anything. For this, you don't need any hi-fi medical information, or you need not be a nurse or a doctor for all this. See, because home care is something which is essential to be thought of, learned, and done for everyone. See, we are all family. We all have parents, siblings. Should we not look after our own siblings or parents in a nice way? So this is something very, very essential, very simple, and if learned, will help us all in some form or the other. And these are the important C's in care. You have to have care, compassion, competence, communication, courage, and last but not the least, commitment. If you have all these C's, you will definitely be a good carer. Next comes social issues. What are the social issues? There are many, many social issues which can arise, and we will see some examples also. But the important thing is, how can you be able to solve some social issues? First thing, you should try to have one-to-one conversation with the patient or the carer. See, sometimes the patient may not want to confide with everyone. So, but they may, even though they don't want to confide with their family, but sometimes they still would want to convey to someone and get some solution for it. So if you have a one-to-one conversation, they will slowly, or they will or they want to confide in you, and you may be able to get to the bottom of their issue. And again, by being patient and showing them the right body language and giving them confidence, they might confide. And because they may think something which is very big, but it might not be so. And then we can collectively look into solution. You can tell them, oh yes, okay, don't worry, I can find out, or I can at least look at other options, what are there. And finally, you may be able to get an achievable solution. Also, for example, normally we could say that some stigmas may be there. They may see, the stigma is all how and what you think. The other person may not even think so. And then mainly in this type of stigma type of thing, main is not being aware, not knowing the correct thing. Assumptions, myths are very, very common in these type of situations. So just little bit more knowledge, little bit more awareness, explaining things to them, and whether all what they are thinking is right. So they themselves may not know. So going little bit deep into it, in enhancing or increasing the knowledge of what is to be known will be very, very helpful in that regard. So if you take individual situation, identify them, analyze them, and then sit and talk with them, they may say, oh, I was wrong, I did not know this. Okay, thank you for explaining. So situations like that, for that, we may have to know in great detail and then explain to them, so that ultimately a better solution could be achieved. Next, psychological and emotional issues. Again, this is a challenging task too, because emotional issues and things do happen. Like it could be some simple interpersonal or family issue, which they might have been brooding on. They didn't want to convey it to them, or they did not know how to convey it. So those type of issues could be there. Here in these respects, you can get the help of a psychologist or a counselor, so that you can set up some, we call it as multidisciplinary meetings, where you get the patient and the psychologist. Because with the patient or carer, or as I said, it could be a family issue, it could be a personal issue, anything like that. So those type of things we have to, if we get the help, if facilities of a psychology or a counselors are available, we can utilize. If not, we may have to play their role also. It all depends on resource availability in these type of situations, to know what is available, and then we utilize what is available. If not, we try to enhance our skills. Okay, and then, as I said, if you convey to them the power of being empathetic, that itself will make them confide. And then silent, active, attentive listening may do big wonders also. So then they themselves will, they might not have thought that they wanted to confide and explain it to you, but they may think, oh no, the person is very good. So maybe so many years went by, I did not try. So maybe I will ask. So it can open up things which you might not have even thought of. And and if you give some solutions, and if the solution gets, if it is helpful for them to solve, and it will be a fulfilling task finally. It will be a fulfillment for the person and for you too. So see, emotion is all like, if you sit back and think, as I said, broad picture will have a big role in emotional issues. So looking at it in greater detail and getting the help of counselors or psychologists will be very helpful to get some final solutions to. Next, financial issues. See, financial issues can be very, very varied, and it could be a very important one too. Okay. From financial issues point of view, I'm just going to give you a simple example. See, many families may have issues like the person or the patient could be a breadwinner. So they may have children who need assistance with education and things like that. So I'm giving a simple example. As I said, financial issues can be from schooling to anything that you can think on earth, from supporting medical services or paying for medical services. So it could be a Herculean task. It could be a mammoth issue also. But I'm just taking up a simple issue of supporting education for children. Because if the person or a patient is the breadwinner and their main worry will be, oh, how will my children survive? How they have to study. So something like that. So from that point of view, what you could try and do is you can involve some local charity organization, because there may be people who want to help, but they might not have known whom to help and how can I help. So involving some local charity organizations and trying to make a bridge between patient and organization, so that, see, we know like demand supply, there is people are willing to give, but they don't know where to give. And here you have people who need the help. So just forming a bridge for these type of things, what does and can work is that, see, there may be organizations, and then you can get someone from the organization to link to the family. So either way you can do, or you can get the organization come and meet for example, if there is a hospital or a palliative care center where you may be getting patients and family coming and seeing, you can ask the organization to come and meet them once a month, once in 3 months, something like that. Or you can have some meetings set up. So not only for help, they may be helpful. Some people may be, they may say, if I get some help, I would want to do something in return also. So like that, it would be a two-way benefit for the charities also. So something like that, setting up groups, setting up regular meetings will help both the organization and the people who need the help also. So it would be a bidirectional or a two-way process and two-way benefit also. Cultural and spiritual needs. Again, this is a very sensitive one, because all of us may have some cultural ideas and practices, and it is very much based on the regional differences, and we have to respect each one's cultural habits or practices, because that's how the whole of their life they have been. Suddenly you change something, that won't work, and that is not fair and square also. So we have to give sufficient importance to each one's cultural needs or cultural respects, and then try to do what best we can do. Not to force anyone to any one particular thing will never work and will not be nice also. So based on their need, even if we don't know, we can ask them, what is that you would like to do? And then see what best we can help them with. And next is spiritual needs. Spiritual needs also has to be understood. Here, one thing I would like to mention, religion and spirituality are entirely two different things. Okay? Religion as such is just faith practices done by communities as such. Whereas spiritual or spirituality is an individual feeling or individual understanding of finding what is meaning of life, what is meaning to life and things. So it has a very great role. And again, from spirituality as such in palliative care, very many studies have been done and also clearly found out that people with spiritual understanding and beliefs deal and tackle with palliative care much, much better than someone who doesn't have that. So not that it's only a must, but that also has been done because many studies they have seen on quality of life, and then for quality of life in people who have spiritual beliefs and things, they deal and manage things in a better way in palliative care. So that is also some information. Okay, to summarize, what are the 7 C's of communication? It has to be clear. Information has to be clear. It has to be correct. No additional information. What is needed and what is true. And it has to be complete. It has to be concrete. It has to be concise. It has to be coherent. You're not going to say stories which are not related to it. And it has to be courteous. That is very, very important. Okay? Okay, now we have seen so many things. We have seen the skills. We have seen the importance of these in palliative care. How are we going to be able to acquire these skills? Yes, nothing is difficult on this earth. Okay, practice makes perfect. That's what we're going to do. First, by undergoing training. That's what all of you are doing now. Okay, training and then retraining if and when required. Okay, we train, we do some things, then down the line we find, oh, no, I need some more training. I'm not perfect. I'm not up to the mark. So you can go back, do some retraining if and when required, and working together as a team. Here, I would like to say one little word. Working together as a team. There's no I in team. That is what you have to understand. Remember, I would repeat once again, there is no I in team. So I, me, all that doesn't exist in team. So there's no I in team. So that's an important take-home message. And keeping patient's best interest as the point of focus is very, very important to be successful in palliative care. And respecting each other and also maintaining dignity of one and all is what we have to practice on a daily basis. Thank you to one and all for being patient, and I would be happy to take questions and answer. I'll end sharing screen and then we will go back.
Thank you, Dr. Anuradha, for that excellent informative session. So the line is open for questions now. So whatever Dr. Radha has mentioned, communication is indeed the most important thing in palliative care. So likewise, we can acquire it. Communication and all, it's not an inborn skill, it's a learned skill. So definitely we have to learn it. Any questions regarding communication, you can come up right now.
Was it like it was a different group of people? Was it helpful, or how do you all feel covered? Like,
yes, ma'am, it was very helpful and a different perspective towards the palliative care we got today. Thank you so much for that.
oh, very good. Thank you. Thank you.
We have a comment also, ma'am. Yes, ma'am, it was very helpful. Thank you, Ariba and Padmaja, ma'am.
No, more so as you all start to participate and do things, that is when you have to utilize everything. So as we always say, when we cover any of these topics, we give enough and more information. Okay. What I normally say is you have to go back home today and at least note down somewhere and keep. Or like today's world, everything is electronic. Somewhere electronically, at least you have. So when you want to go back, you know, oh, yes, this is what I want to see back again. So you will have something to, you can share my presentation maybe to them so that if they would like to take it. Because as I said, only when you start doing, when you practice stuff, that is when all these will come very, very handy.
We have taken notes, ma'am.
Thank you, thank you.
Thank you, ma'am. So, ma'am, Dr. Radha, we have a question. Spiritual needs, when fulfilled, give satisfaction to patients. How can we identify the spiritual needs of the patients?
Okay, that one you have to ask the patient. Okay, so that one is basically, like as I said, not everyone, but if people have ideas, then they will say, this is what I would need. See, maybe some people would love to have prayers. This is being done in all walks of life. For example, they would like to have some chantings. If they want to have some recitations, I would give examples in every walk of, or every, exactly whatever they practice. So some, for example, Christian, they would want to ask someone from church to come and read the Bible. Similarly, someone from some other religion would want to recite some Bhagavad Gita slokas. So they want to listen. So they want something like that. It is all based on individual spiritual need. They say, this is what I feel. I would like to see what's the purpose of my life. What is that? Every minute, even that last minute, you can do something. There's nothing that, and not always, one thing to understand, palliative care is not end of life care. Okay. Palliative care is you start the care for someone to give better quality of life. So it may go on for like 3 months, 6 months, 1 year. So yes, I would like to listen to these. So I would like to make my life more meaningful. I would like to be a good person. I won't be harsh to anyone, even by words, even the words that I use. So like this, these are things. So basically, and that will give soul satisfaction. So the spiritual need, whoever asks, so that, what is that? So that soul satisfaction is what they want to achieve. So that is what they know, what is life, what is meaning of life. So if someone who has asked spiritual means, they should know who am I? They say, who are you? So are you? So those type of things, those type of people will have a different perspective to life. So according to their need, you see what best can be done. Have I answered the question? Or if you want to ask anything more, I will try to answer.
Thank you, ma'am. Vidya asked the question. Vidya, you need more clarification or any supportive questions? Yes, ma'am. Thank you so much. Thank you.
Very good.
So, ma'am, we have another question. How do we explain to patients or family to discontinue harmful cultural practice? Any example you could share?
Okay. See, for example, I'm going to tell you a simple example. I don't know whether for jaundice, what they do, they will burn. This is what I've seen. So if someone has any different idea, you can say. See, I don't know what exactly is the practice, but they do that. So you can tell them what harm it does. So you can say, see, even for example, if you see in any medical practice also for jaundice, you only, it's an infection. We will try them what you should not take and what are the secondary methods to be followed, like that. So you have to explain to them, see, by doing this, what is the harm you're doing? What is the benefit you get? So it will take time. We have to explain to them. We have to be more patient. They may not accept and agree with you straight away. What I said is one example. So like that, we have to put the effort and tell them, see, what is the harm that you're causing by doing this? That is, 1 second, let me see the question again.
Discontinue a harmful culture practice. Any example you could share?
So that's all. This is something, continue cultural practice.
Dr. Radha, you can continue.
1 minute. 1 minute, dear, because there was another question also. I will. The other question is soft skills. Soft skills also, all what we have seen, like how you present, the non-verbal gestures, everything has to be looked into. All the skills which we have seen have to be made sure that you're able to see and do. Like, see whether you're able to analyze, if some problem comes, how are you going to analyze the problem? That's all, doing step-by-step method, and then seeing you do critical thinking. You take an issue. For example, we can take any social or cultural issue itself. They say, they will say, no, I will have to do things only in this particular way. I would not want to change. For example, I will not eat so many days. I'm just taking a simple example. But see, already the person may be very sick. Yes, you say, yes, you don't want to eat. Okay, you don't want to eat solid food. You drink something liquid. Because we have to see, we have to tell them, okay, no, you can tell them the pros and cons. I'm going to give an example for each. For example, cultural issues, as I say, someone will say, no, I won't eat at all. So eat at all. Okay, you don't want to eat solid. Are you okay to eat liquids? Or are you able to have fruits? Something like that you can tell for cultural issues. So, and then analyze, and in that itself, I'm going to try to give example of using your soft skills. So there you see what the problem is, and then discuss with them how can we manage it, and give them the outcomes. If you do this, this is what you will get. If you don't do this, this is what will happen. So I've used both, taking a cultural issue and using the soft skill, how to manage it. So soft skill is basically to see how you can, as I said, take the problem, analyze, come up with solutions, and then discuss with the person, are you happy to deal with this in this particular way? And then arrive at a solution also. So these are the soft skills which we have to use. Basically all the communication skills, and then the soft skills are thinking, analyzing, deriving solutions. Those will be the soft skills.
Thank you, ma'am. That was asked by Anaka Paul. I guess that was explained. Thank you. Yes, Dr. Radha. So next is Bhavana Joshi. Have asked to share some examples. May I know, Bhavana, what sort of examples are you mentioning? Bhavana, you can unmute and speak.
If you, because cultural is a very regional one. So if there is any particular thing, it will be better to share. If it is something which is not very confidential or something, and if they like to share, they can say.
Okay. So any other questions to Dr. Radha?
Yeah, I have a question. My name is Nived, ma'am.
Yes, Nived.
Yes.
Suppose you want to bring a bad news in terms of revealing a serious disease to the patient. So, and you feel that the patient is not mentally very stable who can take this news. So, are you supposed to disclose this news, or you kind of decide how much to?
See, in this only where, see, if someone is in a condition that they will break down, you are not. That is why I said with breaking bad news, there's a full set. Okay, with breaking bad news, what you have to do is, first we have to assess what the patient is in what condition. Okay, our ultimate goal or aim is to tell the news. Okay, but there what we will do, first we will find the correct situation. Okay, next, find the correct situation, and then try to, you need not tell everything. So you start telling to them and see how much they are understanding, because that is where the phase of denial will come. They may even know that they are not all right or something like that, but they don't want to accept it, because as human beings, we don't want to accept. So it is not that in your first meeting, you have to say everything, nothing like that. So we have to find what the patient's condition, what do they know, and is it the right time to tell? And by 1 or 2 meetings, you yourself will know, and the patient also will know. So you find the right time when to tell.
Okay.
And then, so see, because you don't want the patient breaking down in front of you, and then it's not good for the patient and not good for the person telling also. But at the same time, you don't hide something from the patient also, because that is also not right. Because the patient might want to say, no, if you had told me before, I would have done something different. So both the person who is trying to convey and the person who is going to receive, both should not be denied anything. So finding the right time, the right situation, and when to tell, because the person will need to have someone with them. If you say something and they break down, it's not good for you and not good for them. So identify, we have to tell, but take one or, that's why that is when we say we gain rapport. The person also will say, okay, I am in, sometimes they themselves will come and tell, oh, I have been thinking, because nearly 2-3 times I've gone to the doctors and I'm getting reports one after the other. So I am also not very happy with what I'm, so I would like to get a little bit more. They themselves will come someday with that type of statement. That is the time for you to utilize and tell them then what is that you want to say. And then they will also receive it. So by 1 or 2 meetings, when you're seeing, you find out what is the best, when is the right time to say, and then don't be without telling also. That also won't be good. Sometimes there's another issue called as collision. It's one, like for example, father-son. Father might have the problem. Son will say, no, don't tell my father. You tell me, don't tell him. Again, that is something which you have to deal with properly. You have to, initially the son may be telling that, but in due course of time, you have to tell the son also, it is not right from your point of view to do that to your father. That is where empathy comes. Then we have to say, if it was you in your father's place, would you like to be treated like that? Oh, then he may think, oh, then no, sorry, I did not think like that. because the father might have some issues which he wants to solve, but the son not. That is called as collision. That is another topic as such. So that also has to be dealt. How? First we have to tell the son, oh, this is what is the issue. This is all what we have to do. This is the duration of time, everything I've said. Then you say, how long it is high time? We have to tell your father also. We will find the best time. Maybe you yourself can tell, I will be with you. You can tell. Then the son will think, oh, maybe. Then he'll say, oh, he himself will want to say, or he'll say, no, I will also be around. You tell him. So see, that everything happens. All this you will know as you see patients and families and meet and do things, whom you would have thought that they won't believe you and think, they will completely turn around and come and say, oh, sorry, I was wrong. You please tell. So it will come around like that. By seeing and doing things, you will see all this. And you have to find the best time and situation and then come. Because it's not right to be without telling also. Because see, more than the patient, we also ourselves will also feel bad. As I said, in this whole 1 hour, we have to look after ourselves and we have to look after our patients also. All of us, end of the day, have to be good. That's the ultimate aim. Okay, hope I've conveyed.
Sure, yeah. Yes, sir. Thank you.
Thank you.
Thank you, Nived. Ma'am, one more thing, like Bhavana Joshi have asked about some examples of empathetic communication. One example you just gave now. Any more examples you want to share with the group, ma'am?
See, empathy is what is always no. If they being in their shoes, an example what I can say is someone. In some family, they are having someone who is not. For example, take father is not well. I'll take my example. My father was not well, very, very sick. Okay, I'm going to someone who may have father who is only 40-year-old. So they may not know what is my mind frame and what is that I'm going through. Whereas the other person who is having a young father also, but see, if you are going to be a carer or you're going to go do voluntary work, you have to develop these skills. That's why it is said. So there you can't go say, no, I don't know. See, then they'll say, oh, what is this? This person is not having any interest in me. That's why I see this body language, everything has a role. See, how would you feel if you are in that position? So that is what exactly. So I would like to speak. See, okay, everyone may not have had some difficulty in their life, but seeing everything in a broader picture. So when you're going to do some service or something like that, you're going to see someone who is struggling. You can't go see like put big music or noise. Will you do that there? So that is what we are trying to say as being empathetic. Being considerate, looking at their problem as something which if I have to go through that problem, how would I manage and do? So that is what being considerate is another way, another equivalent or synonym for empathetic. So looking at their problem as if I had the problem, how would I deal with it? That is what it is.
Thank you, ma'am.
Being generally, many of these characteristics, they are all being human, which is becoming a rare commodity in today's living. But that is what is essential. Because, see, in the long run, values, virtues do take us a long way. All of us do have. They are all inside us. Only thing, they're all sleeping. We have to just wake them up. That's all.
Thank you, ma'am. Ma'am, Sunanda, our project officer, wishes to share something. Sunanda, you are...
Yeah, hi everybody, good evening. It's just about what Dr. Radha was explaining about the spiritual needs. So I just thought of sharing what I have experienced. So like I have a special passion of visiting the nearest, senior living citizen homes, during weekends or something. So it so happened that I'm talking about just a month back. So I visited there, and within few minutes of my arrival, I could feel that they were like just wanting someone to hear them. So what I did is the first 15 minutes, just I heard about their, fears and concerns, and then like everybody wanted to share. So sometimes I feel this is what they want at this age. They feel, nobody's around them to listen, and they have so much to say. So I spent about an hour, and ultimately, like, I was a listener and so much to learn from them. So at the end, when I was telling them a bye, I said, like, today was a great day because I tagged a name for them, like pearls of wisdom. Like each one of you have so much of experience in life. If I just, understand, take one point from each of you, I'm going to have a good life ahead. So they were so happy. So sometimes spiritual doesn't always mean that you have to, like, do some chanting, or sometimes just listening to them works wonders. And also in my second visit, I tried to, go for some meditation kind of thing. They also loved that because they said, chanting or kind of this kind of stuff gives us so much of peace of mind. So I think this was my experience. It was a good one. So I just wanted to share that. Thank you very much.
Definitely. Definitely. See, that's what, it's always nice when we say these things, okay? When someone tells it as personal experience, see, most of the things what I've told you are from, like, as I said, I've worked in palliative care for 4 years. I would see 40 patients every day. So all from what I have experienced in my day-to-day clinics only I've told you. So that is what it is. So personal, what we see, what we hear and all stays in our head for a long, long time. So that's all. But just see this meaning of life, it's big word, but very simple. Calm, quiet, peace. That's what everyone wants. I don't want to be bashed. I just want to be calm and quiet. So nothing big. So we don't ask for something hi-fi and expensive ones. It is so simple and easy, but we don't share. That's what it is. So nice. Thank you very much.
Thank you, Sunanda, for sharing that really good thing. So, ma'am, we have another question. Sometimes carers give up the condition of patient suffering from life-limiting diseases and just provide basics to the patient. In that case, how can we make them understand about the need of care?
See, here again, basic care, utmost care, everything is personal. Okay. So it is all what is possible. See, you can say what has to be done, but you also have to see what practically happens. All of us want 200% to be done, but are we able to do it on a daily basis? So as she had mentioned in that, is the question from Vidya, is that right? Sometimes carers give up the condition, the patient suffering from life-limiting, and just provide basics to the patient.
Maybe that carers will be facing a burnout.
So that's what. See, it depends. See, you can tell them that what needs to be done. But again, see, that's what is possible. If you want everything to be done, if they can have a carer, or what is there, then you have to see what is the reason. It could be a financial reason, or it could be a manpower reason. So that is why here many times everything is camouflaged. That is, it's not the truth. You have to dig deep down to find out. So it could be some other issue going on. So that is why you look at many things, get to them, get to know them, ask them, and why, how, and then they themselves. See, all of us want to do the best for our kith and kin. So if that is not the situation or intention, it might be different. So that's why knowing a little bit more, but you may not be able to know a little bit more all the time. because there only all these barriers come. So we have to explain to them, see, this is what is there, but still we can keep and give the person a better quality of life. What is that they would like? What is that you would want? That's where we come to help you. So there you have to gain confidence in them and then find out what is it. Directly poking your nose and asking them, maybe they will shun you and they won't even allow you next day. That is not the way forward. Okay. So you should not tell them you're doing wrong, then they won't let you in next time. So that is not the way forward. So find out what is that, how can I help you, what is the issue, we can do better. If you would like to share with me what is the problem, then as I said, whether it's a financial issue, manpower issue, then we can look at what are options possible. Then I can teach you, if it is, okay, if it's a manpower or financial, as I told you, I can teach you ways and means of, I gave you 2 simple examples of handwork. Like this, I can sit and talk here for hours. You can help them with dressing. We used to teach patients not to buy costly dressing like each Gamgee pad and all. I used to teach them to make sterilized dressing packs at home using your pressure cooker. I can teach 100 things like that. So like that we can teach. Simple means they are equal. What an autoclave is your same pressure cooker. Okay, it's nothing different. So we used to teach patients to do dressing at home by themselves. So like that, we can teach so many things. We used to help them to make, for patients with oral cancer, you can make a solution with stuff at home and wash it with that and then have best oral hygiene care. Like that we can teach. So see, that they may not know. So even the issue, what it is, you talk to them comfortably. There where sympathy, empathy comes. Then you teach them and then tell them. Then they will say, yes, I don't have money. Because I don't have money, I can't do. If you can tell me something, then I will do. Yes, there you go. You find it. Like that. Yeah. See, financial issue is a big thing there. Anyone and everyone will have. See, as I said, personally, all of us have gone. You hire a carer every day for home and see the current cost, no one can afford. Okay. But you should be willing. See, for example, parent children, it's a reversal of role, I say. Your parents one day, today your child. And when you were naughty doing everything to them, they didn't say, go, get away. They looked after you and said, so it's just reversal of role. So it should be a thing which comes from within. You can't, see, communication skills you can develop. Love and affection you can't develop. It has to come from within. Sorry, that's what is the truth. All of us know this. I'm not talking Greek and Latin here. Every one of you know all this. I'm just reminding, that's all. These are all very sensitive issues.
Thank you so much, ma'am. You explained everything in a beautiful and effective way.
No problem, dear. See, that's what we are here for. I always think if one person gets benefited out of it also, all thanks to God.
Feeling glad to be the part of this training.
Thank you, Manmeet, and thank you, Vidya, for that question. Anything you want to share, comment, or ask, you can do it now. We have got another 10 minutes.
The smile ma'am carries on her face and the way she explains things is so beautiful. It made the session extra interesting and nice and very personal. We thought very nice, ma'am. Thank you so much.
Thank you very much, dear. Thank you. As I say, all thanks to God. And I keep telling, thanks to God and my parents for getting me through to this profession, and all thanks to God. That's it. That's how I take it.
It was a pleasure attending this session.
Thank you.